Good afternoon, Linson Heike. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, Mihiraa. It's good to see you again. How are you feeling today?
Hello, Linson. I'm feeling okay, just a bit tired, but I suppose that's normal at 34 weeks.
It's completely understandable to feel tired at this stage. I've just reviewed your results with a doctor, and would like to have a chat about them and what we'll do next. My task right now is to explain the findings from your checkup today. Mihiraa, we recorded your blood pressure a couple of times, and it was a little higher than we like to see. We also did a urine test, which showed a very small amount of protein. The doctor has seen these results and has asked us to do some additional blood tests today to get a clearer picture.
Oh, I see. A higher blood pressure and protein? What does that mean for me and the baby?
That's a very important question, and I can hear the concern in your voice, Mihiraa, and that's completely understandable. I want to take a moment to explain why these further tests are so important for you and your baby. The main reason we are taking this so seriously is because of the combination of the two findings, your raised blood pressure and the small amount of protein in your urine. When these two things happen together, it tells us we need to look a little deeper. We want to do two key things. First, we need to get a clear picture of your baby's growth and well-being, and second, we need to rule out a condition called pre-eclampsia, which is specific to pregnancy. I know that word can sound alarming, but please know that this is precisely why we monitor so closely. The real importance of all this is early detection. By identifying any changes now, we are in the best position to prevent potential complications for you both. It allows us to provide the most appropriate treatment at the right time and to put a clear plan in place to manage your health, all with a single goal of ensuring a safe and healthy pregnancy for you and your baby.
Pre-eclampsia? That sounds serious. What will these tests involve?
Of course, let me walk you through what these tests will involve so you know exactly what to expect. First, we will do a simple blood test, which is very routine. This will help us check how well your liver and kidneys are functioning, as these organs can be affected by changes in blood pressure during pregnancy. Secondly, we have scheduled an ultrasound scan for you. I want to reassure you that this scan is not uncomfortable. It's the same kind you've had before. It gives us a wonderful opportunity to see your baby, carefully monitor its growth and movements, and also check the blood flow through the placenta to make sure your baby is getting all the oxygen and nutrients it needs. I know this can feel like a lot to take in, so I want to be very clear that what we are seeing at this stage is very mild and is actually quite common in pregnancy. The most important thing is that we have caught these early signs, and because of that, we are in a strong position to manage everything closely. With this careful monitoring and the right care, our shared goal is completely focused on keeping you and your baby healthy throughout the rest of this pregnancy. How are you feeling about all this now that we've gone through it? Do you have any specific concerns or questions about the tests or what happens next?
I'm worried, of course, but it helps to know you're keeping a close watch. What should I be doing when I'm at home?
I'm glad you asked about home care, Mihiraa, as it's a very important part of your care plan right now. The main goal is for you to be cautious and to rest as much as you possibly can, listening to what your body needs. A simple but helpful tip is to try and lie on your left side when you're resting or sleeping, as this position takes pressure off your major blood vessels and can significantly improve circulation for both you and your baby. Alongside this, it is absolutely crucial that you know the specific warning signs that mean you should seek immediate medical attention. Please do not wait if you experience a severe, persistent headache that doesn't ease with rest, any sudden changes in your vision like seeing spots or flashes of light, blurriness, a noticeable and rapid increase in swelling in your hands or face, or significant, persistent pain in your upper abdomen. These symptoms are our signal to check on you right away, so always err on the side of caution and call us or go straight to the hospital.
Okay, rest on my left side and watch out for those specific symptoms. I will.
Thank you. My final point, and it's a very important one, is to stress how crucial it is for you to attend every single one of your scheduled appointments from now on. Mihiraa, these regular checkups are our best tool to continuously monitor your health and closely track your baby's growth and well-being. This consistent monitoring is what allows us to be proactive, adjusting any part of your care plan or medication as needed to ensure we are always responding to you and your baby's needs. Think of it as our way of walking this path together, making sure we are always on the right track for a healthy outcome. With all this in mind, do you have any other concerns or questions about your upcoming appointments or anything else we've discussed today?
No, I think I understand. I'll make sure to come to every appointment.
To make sure we are on the same page, let me just quickly summarize our discussion. Mihiraa, we talked about the two key findings from today: your slightly raised blood pressure and the small amount of protein in your urine. To look into this further, we have planned a blood test to check your liver and kidney function and an ultrasound scan to monitor your baby's growth and the blood flow from the placenta. We've also covered the important steps you can take at home, focusing on resting as much as possible, ideally on your left side, and you now know the specific warning signs like severe headache, vision changes, significant swelling, or upper abdominal pain that require immediate medical attention. Finally, we stressed how vital it is to attend all your future appointments so we can continue to monitor both you and your baby closely and adjust our plan as needed. Based on this whole plan we've talked through, are you happy for us to go ahead with a blood test today?
Yes, that's all clear. You have my consent for the tests. Thank you for explaining everything so calmly, Linson.
You're most welcome, Mihiraa. We'll take good care of you. Let's get those blood tests sorted for you now.